app on your Alexa-powered smart speaker on TuneIn, iHeart, and radio.com.
7:36. Let's get a check on the roads in the Team Hochberg Traffic Center with Jim Talamonte.
In the Avondale neighborhood on Chicago's northwest side at the intersection of Belmont and Kimball, emergency responders are still dealing with an early morning collision there, which involved a police vehicle. Traffic's a little heavy on I-55, northbound River Road to Blodgett, southbound Arsenal to River Road. That's ongoing construction. Farther north to Stevenson is fine. We see no issues on the Edens. Kennedy's good, 20 minutes. O'Hare to downtown, outbound the same. No incidents or delays to report on the Eisenhower. With Ryan, I-57 at Bishop Ford. Tollway traffic moves nicely. Northwest Indiana looks great. Metra has some delays on the Union Pacific Northwest line. Metra is on a reduced schedule now. And that's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next in our 1-hour heating and air conditioning weather center. Cloudy and 46 today. Fog at most reporting stations, although it's beginning to peel off. 35 at O'Hare. Next news at 8. Continuous news coverage at 560theanswer.com. And Chicago's Morning Answer with Dan and Amy continues next on AM 560 The Answer.
This hourly segment is brought to you by HealthQuest Radio with Dr. David Kobaba. Every Saturday morning at 11, right here on AM 560, The Answer.
If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Top of the morning, Dan and Amy. So the Olympics have been postponed for a year. But we can't postpone our economic lives for a year. And President Trump, per his briefing on Monday evening, was quite sensitive to that. You can tell he's getting a little jumpy.
If you had a viable business in January, we are committed to ensuring the same is true in the coming weeks. In fact, we want to make it even better than it was before, and we're doing things to help in that regard. America will again and soon be open for business. Very soon, a lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
And interestingly, New York Governor Andrew Cuomo, who is dealing with by far the largest outbreak in the country. I mean, New York is 10x the next highest state in terms of number of cases. He was so signaling the same thing, that he's got people working on the prospect of restarting the economy, too. He's worried about it.
Remember, you study the numbers across the countries that have been infected. The survival rate for those who have been infected is like 98%, right? A lot of people get it. Very few people die from it. So how do we start to calculate that in? We implemented New York Pause, which stopped all the essential workers, et cetera. We have to start to think about New York forward. How do you restart or transition to a restart of the economy? And how do you dovetail that with a public health strategy? As you're identifying people who have had the virus and have resolved, can they start to go back to work? Can younger people start to go back to work? Because they're much more tolerant to the effect of the virus.
And you know what I love about Cuomo? Every day when he has his meetings or his press briefings, he talks about the recovery rate. Yesterday, 12th of, we have these cases, but this is how many have recovered. And we don't get that here in Illinois.
It's helpful data. It's also helpful that he's at least asking the questions. He didn't have any particular answers, or at least good ones. But the fact that he's raising the questions will hopefully get others to raise the questions, too, particularly as things stall on the Hill. At least they did yesterday. Larry Kudlow with Ed Henry about the Senate Republicans' aid package that was being debated as Nancy Pelosi came over the top of their $1.8 trillion stimulus deal with a $2.5 trillion stimulus deal that included all kinds of progressive, woke wish list items.
We can't shut in the economy. The economic cost to individuals is just too great. So let's see how this thing plays out. More testing is essential, and we're loading up with tests now. That's going to be a big help. But the president is right. The cure can't be worse than the disease, and we're going to have to make some difficult trade-offs. I'm not the spokesman. I don't want to get ahead of the story. I spoke to the president about this very subject late last evening, so we'll be looking at a number of different things. Let's give it another week.
And you're optimistic you'll get this deal in the Senate today? Real quick answer. Optimistic?
Either today or tomorrow, Ed. I just can't believe that the other side of the aisle won't help us on this. I just can't. It's beyond my head to know that they won't help us get through.
We'll see if it happens today. It didn't happen yesterday, obviously. For more on this, we're pleased to be joined by James Capretta. He's resident fellow and holds the Milton Friedman Chair at the American Enterprise Institute. That's a big chair to fill, where he studies healthcare entitlement and U.S. budget policy, as well as global trends in aging, health, and entitlement programs. James, thanks for joining us. Appreciate it.
You're welcome. Glad to be with you.
I wanted to begin with this piece that you co-authored over at realclearhealth.com with another colleague from the American Enterprise Institute, thinking about the uninsured during this pandemic. And some of the proposals that you had that perhaps should be included in what the politicians on the Hill are debating with respect to making sure the uninsured aren't disincentivized from getting testing, particularly if they're showing symptoms.
Yeah, no, I think it's very important at this point where there's obviously going to be a lot of economic dislocation. Many people are likely to lose their jobs in the coming weeks and months. And when they lose their jobs, they very frequently lose their health insurance too. So there needs to be a plan in place to try to limit the number of people who become uninsured, because when people are uninsured, they're less likely to use medical care, and the lack of medical care could lead to additional people spreading the virus. So how do we do that? Well, you need to make sure that there's an open season available for people so they can buy on the individual market. So normally you have to buy your products at the end of every calendar year. They need to open up that process. Every state, some states are doing it now, but every state should do it, so that there's a nationwide open enrollment for individual coverage through probably May or so that everybody can get coverage if they need it when they lose their jobs. You also need to make sure that people, if they have employer coverage but haven't signed up for it, can do so. So employers ought to be making their plans available to people who are still employed but maybe haven't signed up for the coverage that their firm has offered them. And then finally, you need to make sure that those states that didn't expand Medicaid have the option, and they should do it, to at least go to 100% of the poverty line to make sure people don't fall totally through the gaps and don't have any coverage options as this pandemic spreads.
And it's important what you say, because it doesn't require a new program. It just requires flexibility within existing programs. And that's an important distinction where we were talking about, for example, what's happening on the Hill, where people are rushing to, take advantage of the crisis.
Exactly. I think that's a very important point, that we don't have time to stand up a whole new thing. This is something that needs to be done in a matter of weeks, really, days and weeks, not months and years. If you try to create a whole new program to cover the uninsured, you just don't have time to do that. So you have to build on the existing structure, expand it, make it more flexible, allow people to access things that are already there, and get them into coverage as fast as possible in the coming weeks, so that doesn't become an impediment to the public health response that's also obviously quite necessary. By the way, there's a fourth component that I didn't mention, which is there are a lot of people in this country who are residing here without proper documentation. We all know that. And they're ineligible for a lot of the subsidy structures that are available for getting coverage. But we don't want that to be also a problem both for themselves and others spreading the virus. And so we need to make sure they can get coverage too. So there needs to be some kind of program that says, please access care when you need it. Please get testing. Please make sure you're taking care of yourselves and your families. And we will backstop that by paying for the care through the a special fund that goes directly to the medical care delivery.
Well, President Trump mentioned that. He was asked about that. I believe it was the Sunday evening briefing, and he made it clear, maybe it was earlier Saturday, he made it clear that it was covered, that people in this country here illegally, their testing is covered.
Yes, that's a good start. But also, if they need medical attention, they shouldn't be reluctant to get it as well. So they need to take the next step to say, let's make sure that they can get care and get removed, that they themselves remove themselves from others, that they go into isolation, that they are under a doctor's care so that they don't spread the virus unnecessarily as well.
What about those who are undocumented people that are here and uninsured?
Yeah, I was just mentioning that. I think that they should be allowed to access care and have it fully paid for. If they get tested and they have the virus, the care that they get through a physician, any care they get in the hospital system. Look, people who get very sick could end up in an inpatient stay for a number of days, sometimes it's 3 weeks. So, we need to make sure there's a plan in place to take care of even undocumented people who fall into that category. So, yeah, they need to be paid for through some kind of special fund. I don't know if they're going to put that into this third stimulus bill, but if it's not in that one, it should put it into the fourth one that probably will be coming in a few weeks.
There's a debate going on. It's somewhat indicated by the questions, the rhetorical questions Andrew Cuomo asked at his briefing yesterday about whether or not to segregate old from young. The Israeli defense minister made a statement over the weekend that one of the things that they found effective is segregating the old from the young. But there are definitely some questions about it in terms of what its efficacy could actually be long term or even medium term. What's your reaction to that as a prevention, a mitigation proposal?
Well, I think we need to hear from some of the epidemiologists and public health experts about whether they think that could stem the spread of the virus in the population in a way that it doesn't cause undue risk to everybody else. It's quite true that obviously the risks are heavily weighted toward people in an older demographic. But that doesn't mean that younger people don't get terribly sick and couldn't also overrun the health system by, with large numbers of younger, sicker people ending up in emergency rooms and in the hospital system and needing intensive care, perhaps obviously recovering, and God willing, hopefully would, but also overwhelming the system as well. So you have to kind of think through that's a good strategy, but if that then means to normalcy for everybody else, does that also overrun the system?
Greg Mankiw, who is an econ professor at Harvard, as you know, had an interesting proposal for social insurance during the pandemic, as so many of the politicians' proposals have too many steps. He basically said, let's send every person a check for X dollars every month for the next N months, then levy a surtax in 2020, due in April of 21, equal to, without reciting equations. Anyway, essentially, person's earnings in 2020 and versus 2019, the surtax would be then capped. Just to put numbers to it, he said, let's say we send $2,000 a month to every adult for the next 6 months. The adult population is 300 million. That would be $12,000. That'd be 3.6 trillion. But it's not as scary as it seems because these would be short-term loans for most people because of the surtax. So the net budgetary cost would be much smaller, and as he works it out, you're more like talking about $250 billion, according to his math. Even arguing about the math on this, on the margins, the idea of a social insurance for an extended period of time to provide that stability directly, people know, and then you'll deal with the surtax on the back end as you and the rest of the economy recuperate over the next 12 months.
Well, it's an interesting proposal. I haven't looked at it and studied it carefully. I think that could work. Honestly, I think the simplest and best proposal, the one that I've seen that I think would work the best, is the one that just tries to freeze in place all existing payroll for as long as possible.
Right.
So basically, instead of allowing so many firms to get disrupted and perhaps destroyed in this process, save the firms and with it the payroll, and try to resume some normalcy in 3 months. So let's assume every company says, if you keep your payroll at some X percent of where it was in 2019, whatever revenue loss you've incurred, the government will pay for the next 3 months, 4 months. And as long as you keep everybody on payroll, that way everybody continues to get paid, they continue to get health insurance, the companies don't close. And then if there's more normalcy in 3 or 4 months, they can reopen business, and there's a certain sense of turning the key back on, and everything starts to come back rather rapidly. If you let the firms get destroyed in the process, yes, people have gotten cash from the government, but they didn't need to have to find a new job. It takes much longer for the recovery to occur. So I think you want to do is save the companies and the payroll that goes along with it.
He is James Capretta, a resident fellow who holds the Milton Friedman Chair, Uncle Milt's Chair at the American Enterprise Institute, where he studies healthcare, entitlement, U.S. budget policy, as well as global trends in aging, health, and retirement programs. James, thanks for joining us. Appreciate it.
You're welcome. Thanks for having me on.
And he joined us on our turnkey.pro answer line.
Listen to podcasts of Dan and Amy from the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
Balance of Nature, changing the world one life at a time.
I do high school ball. I umpire softball and baseball. So I'm very busy and very active. And the main thing I've noticed since I started Balance of Nature is when I do these baseball, softball tournaments, I don't deal with cramps anymore, which has really been a big deal. Because I used to be basically after 2 days of a tournament, I would be bound up with cramping a good bit of the next day, and now I don't deal with it at all. So that's a real good thing.
Don't wait to see what getting over 10 servings of whole fruits and vegetables every day can do for you. Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order of fruits and veggies. Start your journey to better health today by calling 1-800-2468-751 or by going to balanceofnature.com, and make sure to receive this special radio offer by using discount code CHICAGO.